Well, hi, Dr. Coplin. Welcome to the Genetic Genius podcast. I'm so excited to have you today as a guest on the show, and we're going to be learning so much about the body in relationship to, it sounds like, infections and chronic disease and hydrotherapy. I'm excited to learn.
Awesome. I'm
Yeah.
excited to be here. Thanks for having me.
Yeah, let's first start off. Can you tell the listeners a little bit about yourself, your background, your impact on the planet, your passions?
Yeah, sure. So I'm a naturopathic physician in Portland, Oregon. I've been practicing naturopathic medicine for about 10 years now. I've been in the healthcare field for my entire adult life in different capacities. But, as a naturopathic physician, I work in a primary care setting. We mostly are employing kind of physical therapy agents along with therapeutic diets, herbal medicine prescriptions, homeopathics, all in kind of a clinically oriented manner that is rehabilitating to our patients in front of us. So what does that mean? It means that in any given patient that I'm seeing, I'm trying to figure out what are going to be the best methods to use for that person in order to reestablish some foundations of their health. And that could be a variety of different things for a variety of different people, but it really just depends on, what they're coming in with and kind of, a whole host of things. And it sounds like you have some background on the genetic side as well, which I'm guessing is the name of the cast here, but that's great.
Yeah, totally. Yeah, that sounds great. I love that. That whole picture of working with the body is so important because we're not just one aspect, especially from the cellular level, our body is doing so many different things all at once.
Absolutely. And I think when you have a kind of a understanding of the principles at play and how the body itself is acting and reacting, I think that, reaction is something I think we're going to be talking a lot about today because that is fundamental to a lot of the therapies that I've seen used successfully. Is but the point is that those when you understand how those principles work and how these systems work together, and you have the idea of how the systems are unfolding and what might derange that unfoldment, you can really intervene in a variety of actually quite sophisticated ways, even though the tools might seem quite simple. So, and, just going back, so one of the things that has always driven me is, from the early days of me getting into the naturopathic profession, were the use of these kind of the old hydrotherapy sanitarium style inpatient healing centers and hospitals. And I was always so curious, what the day-to-day operations were like and what type of cases that they seen. So I've done extensive study on that. And in fact, I've actually been throughout Europe going to what now a lot of these places have evolved, and in the modern incarnation, they're usually built around hot spring therapy. So another hat that I wear in my life is with the Balneology Association of North America, where we're trying to promote, a North American kind of concept of hot spring therapy as more than just a wellness practice, but actually for health intervening. Because like I said, I've had the opportunity to learn from these different doctors at these different hospitals in Europe how they're actually applying hot spring therapy for rehabilitation. And it has all to do with exactly what we were just talking about, the systems of the body and how we can stimulate and modulate those systems' responses.
Yeah, water is such a powerful method of healing, and I'm so excited to talk more about it with you today and how it relates to, it does so many different things besides just the immune system, but because of the, I guess you could say, the health crisis that we're in right now with the COVID, I think that's an important conversation we'll get to later today, which will be so fascinating. I'd love for you to, let's just kind of dive a little bit more on the basic level. Can you talk to our listeners about kind of what a virus is and how it's kind of starts and ignites in the system? Because I think people have, all different views. And from the naturopathic perspective, I think it's a great view that you can give our listeners.
Yeah. And, it's interesting because, there's a lot, the majority of my patient visits these days involve some element of this type of conversation because there's just so much information out there. And there's a lot every day. If from a clinical perspective, my gosh, I'm fortunate enough to work with a team of really wonderful doctors. So there's a few of us at the clinic, and we, a couple times a week, we round the bases. Okay, what did everyone come up with? What did everyone understand? Because every day our understanding of this particular pandemic and how the things that I'm sure we're going to dive into in more depth later on, how they're evolving and how our understanding of it changes. But from a kind of basic concept, right? A virus itself is actually a very interesting pathogenic, entity, because we tend to anthropomorphize them and look at them as these bad guys that get out there, but in reality, it's just a little piece of genetic code, oftentimes encased in a protein structure. And what happens is those that little piece of genetic code will attach itself onto a particular area of our body, so a cell, usually a little receptor site on the cell. And there's a variety of ways that this happens, and certain things that might make certain cells more susceptible or less susceptible to this. But essentially, that code then goes through the cell wall into the cell and finds its way into the machinery of our cell. And in healthy cells, basically that machinery goes and builds all the protein structures that carry out the functions that cell's designed to do. Well, when a virus gets in there, the virus actually co-opts that machinery and turns it into a replication factory for the virus's material. So then the machinery in that cell starts making more and more of these viruses, and actually packaging those viruses in the little intracellular packages, and then sending them out to replicate into the body and reinfect other cells and
cause chaos.
Cause chaos. Oftentimes, yeah. There's the world of virology is fascinating, and when we look at I think over the last decade or so, at least it became the hot topic when I was in naturopathic medical school, was the microbiome, right?
Yeah.
And we talk about our relationship with the bacteria in our gut. Now that we're really unpacking that, what we've come to understand also is there's something it's been termed the holobiont, which is a cool word, but it doesn't always give you the meaning of what it is. But essentially, all the different types of organisms that are constantly acting back and forth with our immune system and our body in general, and viruses are a part of that. So it's not so easy to just be like they're good guys and they're bad guys,
right?
And there's a variety of different reactions that different people will have to the same virus, which gets into the individuation of care, which I think is so essential for any disease, but especially for respiratory and acute infections. So.
Yeah, and I like what you said about the individualization, because each person does have a different response, depending on their background. It could be genetic makeup, it could be, how they were raised as a child, the food they ate, environmental toxins. There's everything that can infect, which makes us unique, but they also can have our own unique response.
I usually have this conversation when I first meet a patient, and because we say, look, our genes are what we were given with our life. And oftentimes our genes will actually be affected by, the epigenetic structure, and that's just a whole fascinating wormhole we don't have to dive down to.
Right.
But what I basically say is, look, you're given a bucket. Your gene is the bucket, right? And what goes into the bucket are the environmental influences, everything that you just mentioned.
Yeah.
And so our job is going to be, it's like our bucket's our bucket, but we can totally influence what goes in that bucket and stop that bucket from potentially overflowing.
Yeah. Oh, I love the bucket model. I talk about that with my patients all the time too.
It just makes sense.
Totally.
It's one of the metaphors that I fall back on. But
it's so easy to understand too, because when that bucket starts to overflow, our body doesn't function the right way, or how, I don't know, there's a right way. Efficiently, I guess, is a better word.
Sure. Yeah. And function is exactly what it's about, right? It's about how the systems work in conjunction with each other. And when they're functioning, this is another thing I usually tell patients right off the bat is your symptoms are a sign that there is dysfunction, that the systems aren't, and there's so much redundancy built into these systems that when there are symptoms, it usually means that reactive function of the body has hit kind of a pretty low point. And looking at that bucket model, there's a lot of ways that we can affect what goes into the bucket. We can control, this is why I always talk diet. But this is a lot of the therapies that I use, the physical interventions are to actually stimulate metabolic processes and elimination processes that actually work to drain that bucket. So
yeah, exactly. Yeah, I got to open up the system to allow the bucket to drain.
100%.
Yeah. Okay, great. I think that was wonderful. It gives a really good picture, kind of like, of the virus, what a virus is. And then I wanted to talk a little bit about, the virus is affecting or impacting people all over the planet in different ways. And I wanted to, what do you think about that's going to be like a longer term impact? We're seeing, an immediate kind of acute impact, but will people see a longer chronic impact to their cells and function?
I see. So yeah, that was like
That's a
that
big
could be a
question,
very
right?
big question.
Yeah.
But are you talking on a sociological level or on an individual
It could
health
be
level?
both. Yeah. And of course we'll see, I think a stress impact will be
Yeah.
a definitely a long-term, but I'm talking about, let's say for instance, someone doesn't contract the virus in an acute way, but they have, for instance, a respiratory disease or dysfunction. Do you think that they will see a longer impact from the virus for their chronic condition based from an immune perspective, let's say for an autoimmune patient?
Yeah, so interesting question, and there's a lot there. So I'm going to leave the societal element off today because that's a big
That's
question.
a huge subject.
It's a huge subject, and there's a lot to talk about there. As far as the individual health goes, here's what's interesting is that a lot of the principles that I would apply to any upper respiratory infection, whether it's whether it's started by a COVID-19 virus or any other host of viruses that can cause a upper respiratory infection, the principles at play are going to be more or less the same.
Right.
Now, there are different targets and different scalpels that we might be taking, and again, more so I think it's about how the person is responding and reacting and adjusting treatment there rather than trying to treat the pathogen. So, but when it comes to people who have predisposition or, like you mentioned, autoimmunity, gosh, I mean, the implications I think are. I can't really leave the societal piece out of this because I think the implications have to do with, how we're accessing care, what care is being made available, and how we're prioritizing. And I will say this. I mean, before coronavirus really hit, before it became, before we started doing all the kind of social practice around trying to minimize the spread. Our clinic had been seeing since about last November, and we kept commenting on it. Wow, there's really strong upper respiratory infections. We're treating so many upper respiratory. Well, we've had a lot of those patients who we were treating back then come back in now because now that we've been able to do antibody testing. So we're looking to say again, and it's surprising to me how many of them have actually not had positive. So this virulent respiratory infection that we treated actually was not coronavirus. So what does that mean? That means that they're actually still susceptible to getting an infection from coronavirus. But yeah, it's a complicated question. I don't really have a great
it's okay, I know.
Well, no, I mean it's a good question. I like complicated questions because it means that there's a lot of important aspects to consider, right?
Yeah, and we might find the answer as we continue forward too. I know because
I think that's good because rather than try and just kind of unpack all the different elements there, I think we will get to a lot of this
totally.
Yeah.
Yes, the package will become unfolded.
Yeah.
Okay, so let's talk about, let's dive into the hydrotherapy, because I think this will kind of come back to some of our other aspects of the virus and treating different viral conditions. So I am such a huge fan of hydrotherapy, and I'd love to let's just talk about hydrotherapy. What is it? Because that's what a lot of patients say, what is that?
Yeah, where do you keep the swimming pool?
Right, exactly.
So hydrotherapy is a blanket umbrella statement. It's the use of water as a physical and chemical therapeutic agent and thermal therapeutic agent. The water wonderful ability to act in all these different capacities. It carries, it has a thermic regulation, so it carries temperature, and it can alter our temperature in our body. It has a pressure. It has but there's all these different aspects and ways that one can use water. So again, submersion into a pool of water will have these certain physiological effects on the body. We in an inpatient setting are often using water through compress application. So that means like a towel that is wrung out in a certain temperature of water and placed on different parts of the body. And again, so I told you I was going to start to talk a lot about reactions. So there's two things that are going on with a hydrotherapy application. There's the action of the application, and whatever that is, and we'll get into some different types of hydrotherapy applications in a minute. Yeah. So there's the action. So if I put a cold towel on your abdomen, the initial action is the cold vasoconstricts and closes down the capillaries in the skin, which shunts that blood into the deeper circulatory system. The body then has a reaction to that to that initial impulse, which is to try and warm the peripheral nervous system in the skin wants to try and thermoregulate and hit a neutral temperature with the with that cold application. So it'll then bring blood back up into the skin there, and actually. So you get this kind of reaction that ends up being kind of like a pumping action of the circulatory system. And the blood that comes back up has a whole new oxygen profile than the blood that left. So you can actually intelligently drive oxygen-rich blood to different tissue in the body. Now, that's with a cold application. You can also use warm applications to actually free oxygen from the red blood cells and actually get more oxygen, perfusion into a tissue place that might be hypoxic or low oxygen.
Right, so, getting the blood circulating in the area.
Yeah, so I mean, again, and the thing about hydrotherapy that I think always kind of, impresses people, I should say, is that the methods themselves look very straightforward and simple. It's like you just put a cold towel on the abdomen, but the judicious application of those therapies and understanding the principles and what you're directing, you can really be quite sophisticated in how you are manipulating systems within the body. And so again, there's a direct action of a hydrotherapy treatment, and then there is kind of the tonification reaction that can happen over the course of multiple treatments. And so, there are certain things that we might do in an acute case for any given condition, but there's usually then a convalescent series of treatments to strengthen the systems that we're working with. And so, we can, so that's kind of like classic, and then you can take that in a variety of different ways and pair that with a variety of different other therapies to really enhance action. So we use a lot of physiotherapy elements in combination. It's kind of classically in naturopathic parlance is called the constitutional hydrotherapy treatment.
Yeah, I love it.
Yeah, that's a great treatment. And there are so many ways that even from that core treatment, you can use other applications and other physiologically interfacing therapies to enhance reactivity within the system. Yeah.
That sounds great. And do you, so that sounds like you were talking about using a lot of it in office treatment. So for our listeners and during this COVID time, are there some applications that they might be able to do at home? And we can post these in the show notes too, if there's directions. But I think, a lot of things people are like, how do I do that at home if I can't come into the office or I'm not able to?
Totally. Yeah. No, that's a great question. And I'm hopefully going to be doing some video demonstrations of this too, to actually get people, because they're pretty straightforward, but there is a little bit of nuance in there.
Of course.
And so I should say this, that I don't think that there's any one hydrotherapy treatment that treats coronavirus. It's not like that. And we also, I think it's irresponsible to say otherwise, and not that you were saying that or anyone was saying that, but I just want to be super clear about that.
Yeah, completely.
However, I mean, again, going back to understanding the principles of physiology and understanding the principles of what is occurring within any particular what's the pathophysiology of this infection, I think there's a lot of intervention that can happen there. So what I would say for home hydrotherapy treatments, I really encourage people to utilize them as part of their initial onset of any symptoms that they're having. So if they're, and it typically has to do with the fever and fever management. And in any infectious disease, proper management of the initial febrile response in the body, in my understanding and what I've seen clinically, is the most important thing one can do to help properly treat what's going on. And so we'll use hydrotherapy at home, in the way that it looks are based on kind of how severe a fever one might be running. We don't want to ever suppress a fever, certainly not chemically suppress it with antipyretics and Tylenol, acetaminophen, and all that. And we can get into the reasons why that's a problem.
That would be great. But let's continue.
Fundamentally, though, what you can do is actually use hydrotherapy to actually aid the body in what it's attempting to do by having that febrile response, which is increased tissue perfusion, increased metabolism, and you can help the body release heat. And so typically the basic principles involved would be the higher the fever, the more skin contact with a wet application you want to have. And, the basic one that I'm sure a lot of people who are watching this may be familiar with is, a warming wet sock treatment. Right. And so that, that's essentially you having a pair of cotton socks, wringing them out in cool water, putting them on your feet. That's the worst part, I promise. And then you put on over that, you put a pair of dry woolen socks, ideally. Yeah. And it creates an insulating layer. And that exact action that I just described of the constriction and dilation, you create this pumping action it can really effectively activate the immune system and enhance that whole circulatory response. And can help bring I usually use that for mild fevers to help kind of, basically, again, help the immune system do what it's trying to do rather than so it can do its job in a more efficient window of time.
Yeah, exactly.
Yeah. So as the fever gets higher, we'll want to use similar ideas, but with increasing amounts of skin contact. So we might do a cool wet towel wrapped around the abdomen, and then of course insulated with a blanket of some kind. And what that insulation does is it doesn't allow for too rapid of evaporation of the water, so you get more of that heat conductance, which is creating that circulatory pumping action, right? You're getting that warming up, cooling down, warming up, cooling down. So as the fever gets even higher, I mean, we've managed incredibly high fevers, not incredibly high, but scary high, with doing kind of a full torso, what was called a wet sheet wrap in kind of classic hydrotherapy. And very effective, very, very effective. I mean, going back to those kind of sanitarium models of care, I mean, these since, we're talking about 200 years of clinical care where people are seeing all sorts of infectious disease. And this was in a time before there were other options for how to effectively treat these things. And what was key to the successful treatment in these cases was understanding what process was occurring for that patient and applying the correct therapies to augment or enhance the systems of the body that needed that support. And so there's all sorts of really great trainings for modern physicians that where they can actually go. And there's in Germany there's the Kneipp Institute that is still active. And Father Kneipp, for those of you who don't know, he was a Bavarian priest who learned these methods of hydrotherapy from another, Central European by the name of Vincent Priesnitz, and Father Kneipp kind of systematized them and was very, very famous. At his time, he was one of the most famous people in the world for what he was able to effect. And that Kneipp water cure system is eventually what evolved into the modern naturopathic field in the United States. Those students of his came to the United States and kind of became the naturopathic field as we know it today. So all that is to say is that these treatments and the orientation clinically has been in effect for centuries, 200 years, and is definitely still valid.
Yeah, some of the oldest methods are the truest and work the best, right?
Exactly. No, exactly.
Yeah, especially when it comes to water therapy, because it's so easy, not just using it externally and internally, right?
Well, internal hydration is a key aspect
Yeah.
of any infectious disease, treatment. You need to be hydrated internally and externally. Absolutely.
Yeah, and I love what you were talking about with the sock treatment. My patients know it as the magic sock treatment. I call it, because it's magic, and by the next morning you feel 100% better because your immune system has been activated and it's able to recalibrate.
Absolutely.
With a conjunction other naturopathic therapies as well.
Sure. I mean, this is the thing I always tell folks is with hydrotherapy treatments, regardless of what treatment it is, it's only going to help distribute anything you're taking orally more effectively. So what are the basic principles I use in infectious disease? One is, again, it's things, first and foremost, is things not to do, like don't take the antipyretics. Contact your doctor. It's always important to do that. But also, I always have people reduce their calorie intake. Eat very, very few and simple calories, because when you're in a febrile state, a lot of your physiology slows down.
Exactly.
And so you're not digesting food as efficiently. And so big, heavy meals end up increasing inflammatory burden on the body. So we want to reduce that inflammatory burden and by either fasting or, very light foods. I have patients
broths or whatever.
Broths, exactly. And any medicines that you're taking, whether they're herbal or nutritionally based, like nutritional concentrates, or even pharmaceuticals. My gosh, treated a very stubborn case of pneumonia this past season, and the woman had been on 2 rounds of antibiotics and it wasn't getting cleared. And this is something, this goes back to like, Dr. Carol and Dr. Dick, who kind of promoted and kind of it's where kind of the modern iteration of the hydrotherapy treatments have kind of were preserved and come from. There was like, you can take all the antibiotics you want. If you can't get it into the infection, it's not going to do anything. And you think about what's happening around an infection. And this is so important actually for the current pandemic, because, it's the virus, sure, but really what's causing so much of the deaths that we're seeing is the inflammatory substrate around the infected tissue that's just absolutely collapsing the respiratory function. And so all that is to say, to go back, is if you can't break through that, if you can't maneuver that, all the herbs that you're going to take, all the golden seal in the world is not going to get into that. Same with a pharmaceutical antibiotic.
Right.
I've prescribed pharmaceutical antibiotics, and I will, if I can effectively drive it into the correct tissue. There's people always ask me, well, if you're a naturopath, what does that mean? What do you practice? What don't you prescribe? And say really what naturopathic physicians do, in my estimation, is you have a full armamentum of medical treatments that you understand, and you're looking to find the right combination for what that person needs. And that's, again, it's all about individuation of care. And if I'm going to prescribe a pharmaceutical or an herbal, I still need to make sure that it's getting to the right tissue. And so I'm going to use a physical agent to get that there. And that's where I see the best results, is when you can synergize the treatments that you're using to target and make the most specific treatment plan available.
Yeah.
So I got off topic there.
No, there's no off topics where it's great. I loved what you said right there, because that's so key to which makes us shine as naturopathic physicians, is that it's the difference between looking at someone as an individual, and we have so many amazing modalities in our toolbox, and being able to say, like, between Sally and John, they could have the exact same thing presenting, but two totally different individuals.
Mm-hmm.
And what we would give one patient as opposed to the other is always so different. It's like, you probably get asked this a lot too, like, so what's your best remedy for this? I'm like, well, it's not really just that, because
Right.
there's a lot more factors that come into play, and we have to
Absolutely.
look at the whole individual, their timeline, their history, and so that we can help them to recover to the best individual that they are.
Yeah,
Or even better.
I think it really kind of, you know, belies kind of a whole pharmaceutically based model that we were like, what's the thing that you give for that? What's the A that is going to treat B? When really the thing that's going to treat the disease is the person's reaction, their body's ability to, find and correct dysfunction. And there's again, if you're oriented from that position, all the tools in the world are available to you if you're targeting them correctly.
Yeah, exactly.
It's not about finding the one herb that's going to do the thing.
The magic herb, exactly. Yeah. And I think it's all about retraining, because we've been programmed to be like, this pill will cure me, when it's so much deeper, especially on the cellular level, to be like, there's really a lot more going on, the root cause of how did you get this? How did you get to this place in time? And giving you one thing might help ignite your healing power, but there's going to be a lot more levels of work we need to do.
Totally.
Yeah. Okay, let's see. I think we talked about that. And we talked to, so let's go back and talk about, I saw on your website that the biophysical therapy, is that different than the hydrotherapy practice you use?
Great. So that was something when I was, that was from my clinical practice in San Francisco, which I practiced there for many years. I had a practice in San Francisco proper and another clinic in Berkeley. And the clinic in Berkeley ran with a colleague of mine, Dr. Rob Duplain, and we had that was mostly IV-based therapy, so it was a treatment center. Biophysical therapy was basically what I was calling the constitutional treatment and anything else that I was doing that had a biophysical action on the bodies themselves.
Oh, great. Okay.
At the clinic I'm currently at, the Portland Clinic of Holistic Health, where I practice up here, our clinical director has he's done a thing where he's taken all the different therapies that we've used and kind of puts them under an umbrella called biothermal therapy. Very similar kind of idea, but mostly the reason that I did that was, and why I believe that we're doing it here, is because a patient, you say, oh yeah, we're going to run a constitutional hydrotherapy treatment, and a patient's just like, well, I don't understand. Like that, honestly, I've been asked, like, wait, where's the swimming pool? Because and so to reorient them. So I wanted to give people kind of a word for what we were doing that made more sense in terms of what was actually happening. And biophysical effects, I mean, you look at it's any physical agent has a biophysical effect, and that's how I came to understand these therapies. Was much more about, my geeky brain always wanted to know kind of like physically what's happening on the physiological level, what's happening at the cellular level when we apply a current of therapy through this transcutaneously, or we use this current versus that current, and all that it falls under the heading of a biophysical effect. So biophysical therapy is any physical agent that's utilized toward the action and reaction within a patient.
Oh, great. That totally makes sense. Yeah. And I love that, giving it a different word is such a great idea, because it allows patients to be able to understand it more, because I always get the same reaction. Constitutional what? What is that? So it breaks it down into more kind of a understandable verbiage.
Well, yeah, constitutional hydrotherapy was a term that was coined by O.G. Carroll in the 40s?
Yeah.
People used to go on constitutionals back then. It was like, it was just the parlance of the time. It made more sense.
More sense. Just like a sanitarium. People are like,
I don't think
they're gonna.
I mean, this is my one thing. This is something that I often think about our profession, naturopathic physicians, which I absolutely love our profession. But I do think that we could do a better job of communicating what it is we do with a more updated vocabulary.
Right.
I think it would help I think it helps our conventional colleagues understand, I have conversations peer to peer with, specialists that I'm co-managing patients with. And if I start going, yeah, constitutional hydrotherapy, vis medicatrix nature, they're just like, I'm sorry, what?
Right. They lost you.
Not that these things, not that those concepts aren't valid,
Right.
but there's other language that we can use to speak about them, which I think is edifying for patients, and then also kind of allows other colleagues of ours to see how we can actually play a role in the bigger management of disease care or healthcare disease management for their patients. So.
Yeah, that's great. Yeah, yeah. I think that's a good idea. Let's work on that. New vocabulary. I wanted to go back for a minute, just so you think about, so we were talking about at-home treatment and hydrotherapy. And if you could recommend a specific hydrotherapy treatment for the respiratory system. So like whether they were going to do a pack based on the chest, and alternating hot and cold, something that would be something easy. I know that the magic socks or the sock treatment is great, but since we're really focusing on boosting the respiratory health, and then we can go into some other recommendations you would have from there too.
I'll tell you, I'm a little hesitant to say this is what one does for a respiratory infection, because, and I'll tell you why, because respiratory infections, again, that's one of those things. There's, I don't know, I've seen, a couple dozen pneumonia cases this season. Not one of them was the same as the other. Right. And, there are certain, things that we do in office that might look very similar from case to case, but really the treatments of them are quite different. So that being said, I mean, the classic hydrotherapy treatments for pneumonia are, and respiratory. Well, let me back it up and say that if there's pneumonia going on, I wouldn't try and treat that at home by myself.
Right. You need to call the doctor.
The other thing, but a cough, a tickle in the throat, these types of things. The warming socks is a great place to start. Even though it seems like shouldn't I be doing something more directly over the chest? Right. But there's a principle, where in hydrotherapy, this is a very core principle of hydrotherapy. In fact, that another way that you would want to use hydrotherapy is to decongest a congested area. How do you decongest a congested area? Is you use, you open up the blood vessels of another area and restrict the area that you're trying to decongest.
Exactly.
So you're pumping, you're moving the blood into these areas. So that is, why the wet socks actually have a really wonderful effect that way.
Great.
Typically what I would recommend for folks also is to take a warming treatment before doing that. So whether that's like a hot bath or a hot shower. And that's something that I've been doing for the patients that I have been managing who've been coming down with infections during this time. One of the things that we'll have them do, if they're not, a lot of them haven't been spiking an optimal fever. Right. And there's a few different ways that you can approach, getting people's core temperature up, but to actually simulate a febrile response is therapeutic, because you're using external agents to create the conditions in the body that the body would attempt to create in order to denature and kill the virus anyway. So, again, I have an orientation around balneology, which is, the use of hot for therapy. And one of the things that you can do with that is artificially simulate a fever. So the way that you can do that at home, and this is a great treatment, one that I feel very confident about, is an Epsom salt soak. So if you have a bathtub at home, and here's a little piece that, like in the balneology world, I think the question is always like, well, what are the minerals that get absorbed? At what rate do they get?
Right.
It's a tricky question, and it's something I'd get into at another time. But when it comes to the magnesium salts and Epsom salt, it does require, there is a certain saturation level that one needs to hit in order to truly absorb magnesium. So it's about 5 cups of Epsom salt for a hot bath. So you really need to get that briny bath going. And I say, take it as hot as you can comfortably be in it for about 15 to 20 minutes, and follow that with some of the applications, whether that's on the feet with the socks like we've talked about, or
Mm-hmm.
like an abdominal wrap of cold towels, double
Yeah.
folded cold towels wrapped around the abdomen and then wrapped up in a blanket for 20-30 minutes after that. It's a wonderful way. It's a wonderful treatment because it kind of simulates a proper fever, and then it directs it through with the abdomen. In that case, we're circulating that central mesenteric lymphatic system when clearing that and moving that through, moving that up through the liver, and then it gets filtered out, and you get all these wonderful immune actions that way.
Yeah, that's so key. I love that. And that's great. It's so easy to do an Epsom salt bath for listeners that have a bathtub, like you said.
Yeah,
But it's so therapeutic, but not only just for the immune system in the body, but also for that, just relaxing from the stress level that I know a lot of listeners have been talking about. That's just letting that body just completely wind down, putting on some favorite music or, whatever, to really help you to reach another level of relaxation.
Yeah. And let's talk about stress and relaxation, because, I think that's such a key component of, okay. So maybe going back to the original question that you asked that I didn't feel like I answered very well. Maybe this is the piece that I was trying to get to when you're saying about, okay, what are the long-term implications? So let's talk about stress, and let's talk about what's going on in people's system when they're under stress, right?
Yeah,
So,
and how it affects the immune system.
oh my gosh, I mean that's exactly right. And so two things. Well, one, so for the listeners out there, I mean, I'm sure everyone has some familiarity with this concept, but there's two types of nervous systems in our body. We have our nervous system that moves our hands and fingers and whatnot. And then we have the nervous system that takes care of all our automatic functions like digestion, hormonal secretion. That's called the autonomic nervous system, which has your stress response, your fight or flight response. And then on the other end of that is what's called the parasympathetic response, or the rest and digest response. And so psychological stimulation can push that stress response into that fight or flight response. And we talk about this, the kind of classic, it's like there's the bear that jumps out at you at the woods,
right?
And fight or flight response goes into effect. But what happens when the bear is, the 24-hour news cycle, or the,
right,
the fact that, like, my business might be in jeopardy, or the fact that I have this long-standing, chronic illness that I've been trying to treat, and now my doctor's office isn't as accessible as it was.
Yeah.
These are very real stressors, and chronic stress does have an effect on white blood cell activity in the body, and will actually reduce not just that, but it will affect the other systems of the body that support the immune system, like lymphatic detoxification and proper elimination, and through the bowel. I mean, you're gonna reduce your digestive function when you're under that chronic fight or flight response. There's a term that's made its way into kind of more popular parlance these days. Over the last couple of weeks, I've been hearing it more and more, but it's something that we've been talking about for years and years, which is this allostatic stress load, right? It's all combined, stressors that are picking up until you hit this kind of breaking
volcano explosion.
Exactly. Now, what's one other thing that happens when you're under chronic stress, when you're in that fight or flight response, is you're signaling your respiratory system to utilize these upper respiratory muscles to breathe.
Yep.
And to basically to pause function of the diaphragm. Now, the diaphragm is the muscle that separates your lungs from your abdomen. Okay. And in lung function, the diaphragm will expand and pull the lungs open, something called negative pressure expansion, which opens up all the air sacs in the lungs and allows for oxygen and carbon dioxide exchange. If you're not using that diaphragm properly, which is what happens when you're under chronic stress, you start using these upper respiratory muscles to lift the lungs up, which means that the lower lung tissue doesn't expand as much. Well, what's happening in this particular pandemic that we're seeing is the tissue that's the most in the most danger of getting these kind of chronic inflammatory tissue destruction reaction, these ARDS-like symptoms, which is not actually ARDS, it's ARDS-like symptoms, is happening in that lower lung tissue,
right.
which is being so. Gosh, yeah, that might be a whole can of worms there, uh, but what happens is when we go into this kind of chronic stressful breathing, we're not getting we're not getting as robust a carbon dioxide and oxygen exchange, so we're not oxygenating as well. B, structurally, our lung tissue is not being utilized to its full capacity. And C, our body goes through these subtle biochemical shifts, which actually make our red blood cells less apt to release oxygen to other tissue, which puts us in a chronic hypoxic or low oxygen state, which is pro-inflammatory, and which is, I believe, driving a lot of the more intense reactions that we're seeing, particularly to coronavirus, is the lack of proper oxygenation as a predisposing factor. There's other things actually with immune response. I mean, this we were talking about viruses, right? Do you mind? Sorry, I'm kind of.
It's perfect. You're doing great.
I get on a roll, and then I just
keep on rolling along. It's all good.
Let me just say this, because I think this is important when it comes to coronavirus. Is that one of the things that people are talking about a lot in the last week or so is antibody responses, right? And what does an antibody response mean? What doesn't it mean? I think one of the most fascinating pieces of information to come out of this is that and just to back it up 1 second, an antibody is what happens when your immune system detects that virus. So we were talking before about the virus replicates and it goes on. Well, eventually your white blood cells are going to find that virus, digest it, and take all those little genetic pieces and make these little decoys that go out. And there's kind of two phases. There's different types of antibodies. But there's one of them is kind of like saying, okay, like this is the virus, this is what we need to destroy. And then there's a longer term antibody that circulates that actually basically blocks up those receptor sites so the viruses can't reinfect the cell.
Exactly.
That's what we're looking at when we talk about immunity often, immunity being the ability for reduced viral entry back into the cells. Well, what's super fascinating about coronavirus is that the people who are having the worst cases of coronavirus, people are ending up in the ICU, they're the ones who are having the most robust antibody response. I mean, they're producing the largest amount of antibodies.
Yeah, high antibody response.
Yeah, which is which actually resensitizes the cells for viral entry. So it's like it passes this kind of breaking point where all of a sudden now you get this hypersensitization through. So we got to say, well, what's going on that's causing these cases to generate these intense antibody responses are actually starting to drive. And it's not just that they're causing, it's not just a lot of antibodies, it's that these particular responses are actually driving more pro-inflammatory, what are called chemokines or chemo,
Yep. Cytokines.
Yeah, cytokines, thank you. And so it's this kind of inappropriate physiological response to the stimulus of the virus, which is causing all the really, really intense symptomologies. And I think that going back to patient-centered care, if we can start to identify these things and work with them, I think we can do a lot of good for folks. So.
Yeah. And I wanted to go back to what you said about the breathing for a moment.
Yeah.
Because it was like so key, right? Because
Yeah.
you were talking in the very beginning about oxygenating through the hydrotherapy and then bringing the breathing piece in. And I was wondering if you could recommend some, simple breathing exercises that people could do to really help the lower lung. Have some that you could recommend?
Awesome question. This is again something I talk all the time about, and I'm trying to do some video learning things for exactly this. So here's what I would say. There's two that I recommend. One is part of kind of the work. We do a lot of work at our clinic here in Portland, identifying people who are chronic hyperventilators. And working to rehabilitate that,
because that means someone that's breathing really fast, right? Like when you're talking.
but not like in the movies where they're like it's kind of this low grade but persistent, which predisposes that sympathetic overdrive. That
exactly.
And that is, as I'm sure it's that one factor is an underlying factor in so many chronic
So
diseases.
many. Mm-hmm.
Which is why we work, that's part of our kind of initial workup, is to identify and treat that appropriately. So there is a breathing exercise involved in that,
Mm-hmm.
which, again, this isn't a treatment for, hypoxia due to coronavirus. This is a
Right.
treatment to help re-regulate your respiratory function and work to open up those lower lungs.
Which
And
is so important.
it's essential. I mean, it really is essential. And yeah, and I don't say that hyperbolically at all. It's an essential aspect to how our body regulates our health
Mm-hmm.
through the breath for so many reasons. One is proper oxygen, carbon dioxide. The other is that if you're actually utilizing your diaphragm to be your primary respirating muscle, not only are you getting that lower lung exchange of the gases, but you're actually stimulating the phrenic nerve. I'm sorry, the vagal nerve
Mm-hmm.
that pierces through that, which has a myriad of effects on all the systems of the abdomen.
Mm-hmm.
Digestion, renal elimination, hormonal stimulation, all that. So the breathing exercise is basically having your hands behind your head.
Mm-hmm.
Which, yeah, exactly, you got it. And that shortens those accessory muscles. You recline at a 45-degree angle,
Mm-hmm.
so that you kind of are accentuating a position that allows for diaphragmatic expansion. You breathe in through the nose, just a normal kind of natural to the top of your breath. And when you exhale, you're not going to blow out. You're just going to create, like, pretend you're holding a straw in between your lips, and just let your lungs deflate. So it looks kind of like this. Okay. So there's no particular counting or timing that needs to happen. You go to the top of your natural breath and you exhale to the bottom of your breath. And that you do that for 5 minutes every day.
Nice.
And what
That's
that
great.
does is it resets that. That's like an exercise. It's an exercise in kind of reteaching the brain, A, to use the diaphragm, and B, readjusting that chemical balance of kind of where the set point is in the blood for where your brain is telling your respiratory system how fast to breathe. So we can start to adjust that by doing just that little bit, which allows for better oxygen release and is part of that kind of predisposing, low oxygen states in the blood.
Yeah, and should this be something that somebody should do early in the morning, or if they're having a more stressful time of the day or in the evening? Is there a time that you usually recommend?
I usually have people do it right first thing in the morning, just because the first thing you do before you get out of bed, it's a nice way to wake up. But there's no better or worse time to do it.
Okay.
And you just got to get it in for 5 minutes.
Right.
That's the
Create
key.
the routine.
It's such a valuable and simple exercise. Now there's another exercise that is not mine. It's something that I watched a doctor deliver. He's at the oh shoot, I want to say it was the Royal London Hospital. There's a doctor in London. I have to look up where he was practicing, but he worked with the respiratory therapist at their hospital and this was specific for COVID. He was saying, we need to figure out a way to help people manually open up the lower lungs. And fundamentally, that's what the ventilator treatments are trying to do. They use positive pressure to try and inflate the lungs, but that can often cause some secondary damaging, which can actually drive some of the inflammatory. That's a whole other issue.
Right.
He wanted to find a way that he could help people who, basically stay out of the hospital by giving them something. So I think this is a great exercise. It's a little bit more involved. So I'm going to walk you through it once, and then we'll kind of talk it through. So
okay, great.
It involves 5 breaths and then 2 big coughs. And so with this breath, you really want to expand your lungs a little bit more beyond just the normal, your normal top of your lung. And so you're going to breathe in and you're going to hold your breath for 5 seconds. You're going to breathe out, and then you're going to do that 5 times, and then it's 2 deep coughs. So I'll just demonstrate what a couple of that looks like. So you breathe in, you go. You do that 5 times. So Okay. Now, after the 5th breath, you're going to do 2 big coughs. So it's, and then you go, and you really like get out. And you
Right.
feel a little, I do right now, you feel a little lightheaded doing
Yeah.
that. So you do 2 rounds of that.
2 rounds of that. Okay.
And then you actually lie face down on a bed or a mattress or a couch.
Mm-hmm.
So you're face down like this, and you want to breathe for 5 to 20 minutes in that position, which kind of has a structural advantage for the lung tissue in the lower lungs. And again, you want to breathe just slightly past your normal capacity. What would feel like a comfortable top of your breath. You want to breathe just a little expanded there. And so they worked to that to actually try those things are actually done to mechanically kind of break up and open up the lower tissue of the lung and fill them with oxygen so they can start working.
Wow,
I think
that's
those
great.
are 2 excellent exercises, and I practice.
Yeah, super easy too.
Yep.
Yeah, thank you. And for those of you that didn't see, if you're listening to the just audio, you can go to the YouTube site and see the demonstration there, which is great. I love that. And there's so many other, herbs and essential oils, all types of things that can help open up the lungs. Do you have any, I know we're getting back to just like top 5 or something, but how about top 5 herbs for opening up the respiratory system?
Well, I'll answer that in a slightly different way, which is that the herb there are so many great herbs for lung function.
I know. We have a million, it seems like.
Yeah, and I think like one that I like to talk about is licorice. I think licorice is a fantastic herb.
Mm-hmm.
I think it has some minor kind of steroid-like effects, so it has a bit of anti-inflammatory action. It tastes good. Some people don't think it tastes good. I don't understand those people.
Pretty sweet.
I love licorice, so I really, it's one of those things when people are like, oh, I can't stand it. I'm like, I don't think I get you.
It's like the super taster.
Yeah. That's probably like, we lung formulas that kind of are based around licorice, I think are
it's
excellent.
a great one. Mm-hmm.
But the nutrient that I think is really important to understand is N-acetylcysteine.
Oh yeah.
Which is, basically a precursor for the antioxidant glutathione, which is essential for, basically reducing the inflammatory issues that are occurring in the respiratory tract. And again, another reason why I tell people don't reach for the Tylenol in this particular thing is that Tylenol will deplete glutathione in the body and can actually exacerbate the respiratory issues that occur because you don't have that antioxidant there to neutralize the inflammatory reaction.
Yeah, and it changes the cell membrane. We want that cell membrane to be as strong as possible, like you were saying, to help with the fight off the virus, so to speak.
100%.
Mm-hmm.
Yeah. I think that there are some really wonderful Chinese formulas for the lungs. They're usually formulas that are based around sweet Annie as an herb. It's kind of a classic. It has a ton of research behind it as an anti-malarial. But it also is antiviral. It also
great for the gut.
Yes, and protects respiratory tissue. So there's a few Chinese formulas that have that as kind of the backbone of how the formulas are constructed. Those are wonderful.
I love those. There's so many, and a great way is to get in touch with you. I would think you're seeing patients, correct, at your clinic, and you're just seeing them via telemedicine. You're also seeing them in person.
We do both. Yeah.
Both.
So I'm at the Portland Clinic of Holistic Health. We're in downtown Portland, Oregon. We currently we've remained open throughout this time. I mean, we basically, when the social restrictions hit, again, we kind of had one of those mind melds of the docs and said, look, what makes sense here? And we had to really talk about it because, we had to really kind of understand, well, what is essential care and who are our patients and are we essential to them,
Right, exactly.
We have a lot of patients who are undergoing long-term care for some pretty heavy conditions, and to just not be available for them seemed irresponsible. So what we decided was we need to take action to be a responsible essential care clinic. And so we created a lot of the measures that are now being that the governor has kind of put in place for people to
Right.
reopen are things that we started to do 6 weeks ago, which is, for instance, we have a firewall around our clinic, meaning that if someone is suspected of having coronavirus,
Mm-hmm.
that's where we'll usually have a video chat just like this, and just kind of work up, well, what's going on, and kind of take a case. And if it seems likely that they are in high risk for actually having coronavirus, we will actually do curbside nasopharyngeal swabbing,
Mm-hmm.
send
Right.
that out for culture. And and then if they're negative, we are able to treat them in the office. And it's interesting though now too, it does seem that the viral shedding, it seems to be mostly people who are highly symptomatic,
Mm-hmm.
and mostly people who have cough. That seems to be the
Right.
highest amount of actual viral shedding that we're seeing. So yeah, but because we implemented that telemedicine kind of virtual visit,
Mm-hmm. Mm-hmm.
we've been able to use that for a lot of other patients, which actually has been really great, because we have patients who would drive out from, you were talking about Bend before
Right.
patients who would come out, and then now they're able to kind of access care more regularly with those virtual visits. So.
Yeah, I think that's been, there's been so many bonuses and pluses. There's been a lot of minuses too with the COVID, but that I think has been such a great thing for the planet, for people that live in rural areas to be able to have access to medicine in this new way. Because where I live, I live in the mountains in Nashville too. There's a lot of people that will drive an hour and a half to see me. So I'm like, this is a great way for them to see me, and the care is just as good.
I agree. No,
Um,
it is interesting though. I mean, we've hit that kind of a lot of the technologies that we've just gotten super comfortable with in the last 3 weeks. It's been really funny to me, because it's just like we've been here all the time, and now all of a sudden we're all just like, yep, we're in it.
Right. And the way that, technology is advancing too, we're going to have way more medical apps, I think, surface that we'll be able to use in this, circumstance to help patients too, I hope, in the
Absolutely. And
future.
just to touch on a little bit of the sociological implications of what's been going on. I mean, one of the things, this is Medscape released an article last week that was like, 75% of all medical businesses across the board, not
Mm-hmm.
just, alternative, not just hospitals, but 75% of all have taken a major financial hit during the last 6 weeks. And a lot of them there's a hospital in Central Washington I was reading about,
Mm-hmm.
closed. It was the hospital out there, and
Wow.
now it just doesn't exist anymore. So
It's crazy.
yeah. So we are going to kind of enter into a new era of healthcare. I think it's going to require some innovative thinking and
Mm-hmm.
utilizing tools in different ways than maybe we have in the past, like you were just mentioning about different kind of wearable technologies and things like this to do. I have a patient she's chronic renal failure that we've been kind of keeping
Mm.
stable, and she has her regular visits with her nephrologist, and she was telling me yesterday or the day before when she was in, she was like, um, it's been really nice to just like go to my nephrologist online. She's like, I don't have to drive an hour. I don't have to wait in the waiting room. I just, it's just like what used to be an all day affair was just like a really nice, easy check-in.
Wow. That's
Yeah.
a
So
huge shift for people, right?
yeah.
Yeah. Some of my patients that are chronically ill will spend like a whole day going to all their different appointments. So
Yeah.
yeah, that's a positive thing. Let's hope that continues, that they have more time to rest and rehab at home.
I do hope that that's what comes of this on a more than just for medicine, just on a societal level, that
Mhm.
we've all been given a chance to kind of take a step back and reorganize, and it comes at hardship. I mean, there's some serious hardship out there,
Yeah.
both medically and financially, that's occurring, and it's going to take some novel approaches to how we move forward as a society, and it's going to take a heck of a lot of compassion, and that's
Mhm.
something that I think is really essential at this time more than ever is that we have compassion for other people and what they're going through, and that we can hold that in our reactions and in our interactions with everybody.
Mhm.
It's really easy to love the people who agree with you and who are like you, but I think now more than ever, it's super important to try and love the people that you don't agree with, and see where that takes us as a people. Yeah. Just my little plug for compassion there.
Yeah, no, that's a huge one. I think there's so many ways that we can have different aspects of compassion around the planet for people that are having such a terrible time right now, and helping them as much as we can, which is why we're doing this podcast, hopefully to help people too. I have one more fun question for you, and then we're going to wrap things up.
Great.
So if you had an unlimited budget right now to make the greatest impact on the planet, what would you do? How would you spend it, and why?
Oh my gosh, what a question. What would have the greatest impact on the planet right now? Oh my gosh, I wasn't prepared for this question at all. I think
this is a throw out there question.
Right, but this gets to like, this gets to so many levels of my thought processes. I think giving people access to the basic needs in their life, I think that's the key. I really do. I think that if we all can live our lives in a place that our needs are met, we're not insecure about our housing situation. We know that there's food coming to the table. We know if we get sick that medicine will be provided. I think if we organize our society around that, gosh, what could come from that is just limitless. If everyone's basic needs are met and no one's struggling, or we can try and reduce the amount of fear and I think that allows people to operate from a totally different portion of their consciousness. And I think that it when we work together to help stabilize fear reactions in each other, it really allows us to operate from a place of love. Love is the opposite of fear, right? So I wish I had a cool answer that it was about like some policy thing that we could do to enact, but fundamentally.
No, your answer was cool. That was perfect.
Thanks. No, I need that validation. I really appreciate it.
No, it's so true. Love is changes everything.
Fundamentally, if we're talking about shifting things on a global scale, I think that's the only thing that will actually achieve that. And there's so many ways of getting there, but fundamentally, again, I think it just goes back to how we treat each other in every given moment we have to interact with anybody, a stranger and to a loved one. I think we have, in every moment, we have the ability to choose love as the reaction and the context for which that interaction takes place. And I think that is probably one of the most powerful things that each one of us could do in every moment at any time. And that's going to inform so many other decisions that we make that might have more kind of quote unquote practical applications. But I think if we come at it from that point of view, boy, it was really going to fundamentally shift how we function as a world. Yeah. So.
Life-changing for the planet. Completely. So. Yeah, I totally agree. Okay, well, it's been so wonderful to talk to you today, Dr. Coplin. And what are the best ways that people can, one, make an appointment with you? Is that to go to your website, the Dr. Coplin ND? So
there's a few different ways. Yeah, I would say that right now, like primarily Dr. Coplin ND, or drcoplin.com. That's kind of my personal website. That's where I do a lot of my kind of education material, and I have a newsletter that people can access through there where I do little health videos and demonstrations and stuff, so they can get at me there. Instagram, I've got that, the whole social media thing that we all do now.
Right. So Instagram is, what's your Instagram?
It's Dr. Coplin ND.
Dr. Coplin ND. Okay, great.
So email access through that, or through Instagram, through the website. And then, I'm here in Portland, Oregon at the Portland Clinic of Holistic Health.
Great.
We're accepting new patients. So if someone wants an in-person visit, that would be contacting the Portland Clinic of Holistic Health and setting up an appointment that way.
Wonderful. And you have a blog and newsletter that's going to be coming out soon too. That's
right.
How people can find out all more information and your expert advice and everything.
Yeah, that's right. And if they want to just shoot me an email too, that's Dr. Marcus Coplin. I should really just have them all be the same thing. I'm like Dr. Coplin, Dr. Coplin, Dr. Marcus. Anyway, Dr. Marcus Coplin at gmail.com.
Okay.
And I can sign people up for getting kind of health updates and things like that, or any type of questions like that are a good place to start.
Great. Okay. Thank you. And thanks again for joining us today. I just loved everything we talked about. And if people want to recap, I'll have that in the show notes. And I think there was a couple of things you mentioned, so I'll make sure I get those from you as well. And so thanks again.
Thanks, Doc. It was a real pleasure talking with you.
Thank you.